worldwide this is an issue. I've run a web development business prior, and I've hired people to work freelance for me from Pakistan, you know, and it could be, and it's like data entry type things, and technology, things like that, where trans people are very resilient and learn skills and are able to pick up things quickly. And when it comes to technology, a lot of times it removes certain barriers of transportation, of I'm in the middle of transition and meeting people face to face, you know, certain things like that. So as we probably get more support to be able to do these things, because right now we're doing, you know, with what we can do it with, but there's definitely a scalability there.
I heard that.
Yeah. And she's awesome, and the whole team, and actually Bonn, if you want to jump in, but you know, the whole team, like Owen, who runs the legal clinic, is, you know, I go to DC or I go to San Francisco and bring up his name, and just everybody knows him because he's been doing such cutting edge work already around trans issues, and for him to now then be running our trans legal program as an aspect of the TransLife Center is like crazy, you know. So everybody is really, Lex is really well suited on the housing piece, but I'm gonna turn it over to Bonn.
Sure. So what
talk actually, we keep referring to sanctuary, and I know Jennifer knows sanctuary, but why don't you talk about it, because it's your soul.
So you know, I'm just gonna build off of what you shared. So I think you talked about like the challenges of being like a one-stop shop, and also the challenges of kind of like getting people to be career ready. This is like the greatest opportunity, I think, to have everything under one roof. And so my background, social work, 19 years, 10 years of those 19 in housing. And I can remember in the 90s when we would refer someone to a housing program, they would get into that housing program, so they had stable housing, but then we would have to refer out for employment services, right? Or for healthcare. And so the idea that employment is right here, healthcare is going to be here. You know, we're in the process of rolling out all of the 5 components of the TransLife Center. So I would say we're about 85% there, and we're still building. You know, this is our kind of like second pilot year, but I got to make that transition. We're not a pilot project anymore. We're a national.
I was going to ask how many people come through here.
Yeah. So I'll get to that in a minute, but essentially, you know, with the SPINS grant as the seed money, and then the donations from Jennifer Pritzker and Lana Wachowski, we have a unique and brilliant opportunity here to use the money to build this model to really, and this is what I talk about, I feel like on a weekly basis, if not daily, but we're using this to create space to build up the leadership within the trans community, right? Specifically trans people of color, so that we can help folks, you know, build on their existing strengths and get to the next level. So what we do and how we do what we do is just important as, you know, what we say we do, right? So
I hear that.
Yeah, you know, yeah, because we can just, you know, everything looks great on paper, and you know, we can sit and talk with you about like all of these great, you know, folks we know, and you know what we've got here, and the furniture looks really nice. It comes out of the merchandise mart, which we're excited. But if this is not a program that helps people create purpose and meaning, starting with staff to the, you know, to the residents and to the folks that come through who are not living here, you know, we're missing the mark. And that's why it's incredibly important to talk about and name, you know, the systems that we live in. So certainly, you know, we have an anti-oppression analysis or lens, but we really pull from Dr. Sandra Bloom's sanctuary model, which has 7 tenets, which really drive how we think about building community. So a commitment to nonviolence, a commitment to social responsibility, a commitment to shared governance. So think of like typical housing programs, you know, there are lots of barriers to get in, and certainly we're funded by HUD, so there are barriers to get in. However, we're trying to work to minimize the number of rules that folks have to comply with to live here, and also to partake in the services. And so we're trying to be low threshold, building on what Angelica was sharing. You know, folks have been so traumatized by systems. I don't even need to tell you. I know you know firsthand. that so many people have been traumatized by systems that there's system fatigue and program fatigue. So unless we create a program with purpose and meaning where people can really feel themselves within the space, we're missing the mark and we're going to lose people. So so we have 5 programs: employment, housing, TransSafe, which Angelica mentioned, and I'll go into that a little bit later, TransLegal, and the TransHealth, which is linkage to care. It's linking trans women of color to healthcare around medical or HIV. And then what we do in that TransSafe piece is that we bundle all of those services and we offer, you know, it's like a buffet, it's like a cafeteria. So someone can come through here on those 2 TransSafe days, and it's kind of like drop-in light, you know, because I run drop-ins and I know like what it takes to pull off a drop-in. And right now we don't have the capacity, you know, to run a fully fledged drop-in. And it's also interesting. Have a good day. Peace and love. Oh, the movies. We got movies. So we have it twice a week for 4 hours at a pop, Wednesdays and Fridays, and then we co-schedule legal, employment. We have yoga. So we've just begun to do that. This is our 3rd week actually that we're doing that. And numbers, so far we've seen a lot of housing providers, a lot of social service providers come through to get to know our space for the TransSafe Resource Center days. And we are actually, the person to your left, one of our colleagues, Monica James, who is our newest addition to the TransLife Center team, is working on a strategy along with our community advisory board to really get the word out in the community. So to do that, we've been going to, we just went to a ball, and at 40, I will tell you, for me to stay up till 4 in the morning is a lot.
Dance?
I did, you know what, I hooked it up. I didn't walk, but I did hook it up a little behind everybody. I was doing my little thing, cutting a rug on the side. But so we are at, you know, pivotal places and trying to connect and reach out in the community. And I think the brilliance of everybody sitting around in terms of staff and also residents, the community here, and we don't use the word client here within the TransLife Center, we use participant or resident community member, is that we're all connected to amazing and brilliant pockets within the Chicagoland community. So what we're doing is we're tapping those communities that we already know and kind of joining and saying, like, how can we collaborate? How can we support the work that's already happening and plug our community members in or plug our staff in to do that so that we can get people coming through the TransLife Center to get legal services. You know, on an individual basis, it's, you know, representation in court, name change, vital records change, but we're also doing some advocacy work. We're pursuing an impact litigation case here in Illinois. We're trying to change the vital records so that folks don't have to, you know, go through so many hoops to change their vital records, and we're doing that. And that won't just impact trans people, right? But that will impact, it's so that folks can change their names with a felony background. So we're gonna challenge that. Here in the state of Illinois, you have to wait 10 years post getting out of being incarcerated to change your name. So we're challenging that here in Illinois, and we're partnering with other people, so we know we can't just do it alone. So we're pulling in Lambda, the ACLU.
I'm going to interrupt Danielle. This is Jennifer Ho.
Hi.
Danielle just brought us in.
Nice to meet you too.
Danielle's actually one of the women who came through the social enterprise that helped to get us started here.
Okay.
She just brought us lunch.
All right. Thank you so much. Nice to meet you.
So you know, I could go on and speak for probably the next 30 minutes about everything that we do. However, I just want to say, you know, this is unique. It's a lot of work, and as I'm sure you know, and it's just a wonderful opportunity to build up the leadership here in Chicago, develop leaders, and then get people employed, get people, you know, their legal backgrounds cleared or what have you, housing, and then really launch people. We just had our first graduation from the TransLife Center residents 2 nights ago, and so that person moved into their own apartment. They're working a part-time gig, actually on a youth summit, and then they work for a social service agency, very part-time. But it was very successful, and you know, it's small baby steps, you know, to the goal. Because, and this is what I've seen. This is, you know, the first time that in Chicago, at least, you know, the trans community, we've gotten any money to take care of our community. And so there's, as Angelica said, you know, there are so many competing needs. And so I feel like we are where the LGBT community was like 20 years ago.